Hey guys, welcome back to my YouTube channel, Petra V. Wosu. Before we get into it, I just want to it's a water stain, and just so y'all don't think I'm lying, here we go. I was drinking this. I'm actually gonna take another sip, and it dropped. Looks like I'm already getting breastfeeding leaking vibes already. So yeah, anyway, that's water though. But yeah, welcome back to my YouTube channel. If you've been here before with me, if not, I welcome you to my YouTube channel. Please make sure you subscribe if you want to see more videos. My last video that I posted, I talked briefly about how my first pregnancy differs from this current pregnancy that I'm in my third trimester. My son will be here soon. I'm excited to meet him. We're all excited. But this video, as you can tell from the title, I'm going to be talking to you guys about what's been happening and give y'all the gist. And so we're going to do a little bit of research. I'm going to go on Google. I have my iPad here. I have my notes. So if you see me looking down, I'm looking at my notes, and I'll probably go into Google to talk to you about some of the things that the doctor mentioned to me at my previous appointment. So if you're interested with all of that information, keep watching. So, last visit took place before Valentine's Day. I believe it was a Thursday. And before I talk about currently, let's go back. So, my doctor's appointment that I had last year, last year, pregnant, I would say July, August time. I can't remember honestly when I had my first appointment, but I will say when I initially got pregnant, I thought I was experiencing implantation bleeding. But it was lasting a little bit longer, and I noticed that was a little bit more brown discharge, but it went away by the time I had my first doctor's appointment. My first doctor's appointment was really just to confirm the pregnancy. I called them saying, hey, I'm, kind of bleeding, spotting. I was thinking it could have been a miscarriage. So they were like, nothing we can really do right now. Let's just wait until your first appointment to confirm the baby. So that's what happened. We confirmed the baby. By that time, the bleeding or the brown discharge had stopped. So let's fast forward to after Thanksgiving. After Thanksgiving, I remember it vividly. I want to say it was maybe the weekend after Thanksgiving. I was laying in bed. I was watching TV, Netflix. My husband was in our garage working out. It was like 11 o'clock and I was about to go to bed, but then I felt like ladies can relate to this. When you're on your cycle or when you're about to get on, when it's about to come. And so I felt like this urge, like I wanted to, bleed. So I'm like, what is this? So I hopped up out of bed and I went to the bathroom. So I went to the bathroom and I used the bathroom, I peed, and then I wiped, and I noticed it was like bright red. So immediately I panicked, but I was like, okay, calm down before you tell Emmy what's happening. Mind you, my daughter's still sleeping because it's 11 o'clock at night at this point. So I'm like, wait, what? So then I look at the toilet just to see if it was like blood in the toilet, and there was. Didn't see any blood clots or anything. So at this point, I'm like, okay, calm down. So I called my husband, Sweet Potato, upstairs, and he came upstairs and he's like, okay, let's call the doctor. So we called the doctor, and the doctor said, okay, I think at that point I was 20 something weeks. I can't remember vividly, but I was 20 something weeks. And the doctor said to me, honestly, there's nothing we can do right now because you're still in your second trimester. And the only thing he recommended me do was put a pad on and put a pad on, and then see to kind of gauge to see how much blood. So although I wiped and it seemed like a lot of blood and I saw there was blood in the toilet, he encouraged me to put a pad on just to kind of gauge to see. He said, if it fills up the pad, come to the ER or come to the hospital. And so I was like, for him to tell me there was nothing he could do or nothing they could do at that point, I was kind of upset about that. And I'm like, I'm not risking anything. I want to go to the hospital regardless. So Emmy, Sweet Potato, suggested that we wait a little bit. Let's just see. He asked me if I was cramping. At that point, I'm like, I'm pregnant. So I'm always like, I couldn't really gauge my pain level, but I wasn't in excruciating pain. And then I was also just really, really, really paranoid at the fact that why am I bleeding right now? So then I laid in bed, and then around 12ish, I went to the bathroom again. At this point, I'm looking for any excuse to use the bathroom because I want to see. And it's now the blood transitioned from like a light red to more of a darker red. Still no blood clots, but looks like it's kind of picking up, but nothing on the pad. So it's like little spots, but nothing like I wasn't leaking like, you know, how you would when you're on your period. And so then I'm like, you know what? I don't feel comfortable. We were contemplating on whether I should reach out to my brother and my sister-in-law who live down the street from us to watch Zoe. But then I was like, shoot, COVID, Emmy is not going to be able to come with me in the hospital. So I was like, you know what? Let me go. My husband's like, let's just wait. The doctor suggested that you go to the doctor's tomorrow. And I'm like, I just wanted to go. I'm like, I just need to know, make sure baby's okay and make sure I'm okay. I don't know why I'm bleeding and where I'm bleeding from. So I go to the hospital, get there at about 1 o'clock. So 2 hours after I noticed this bleeding, and the doctor that I spoke to on the phone happened to be the doctor that saw me. And I won't forget him, Dr. Spencer. And he was like, so I see you still came in. And I'm like, yep, I'm here. Check me out. Check the baby. And so they put the monitor on. Baby's heart rate was great. Baby was moving. He was fine. And then so they checked me. And so he checks me and he's like, yep, I see. He said, whatever this is, he said, the bleeding is still continuing. But he said, let's clean it up a little bit so you don't see bleeding for a little bit. And he said, it doesn't seem like it's coming from the baby at all. So not in my uterus or anything. And then he said the cervix, they checked my cervix. I wasn't dilating or anything. So that was pretty it. It was uncomfortable a little bit, but he was kind of like just kind of scraping, and they also wanted to test it out. He said, which I thought was weird. He mentioned that, hey, let's have you still go to the doctors tomorrow. I still want you to go tomorrow just so they can check to make sure everything is okay. So I said, okay, fine. So I leave the hospital, come home, rest, wearing a pad at this point, wearing a different pad at this point, and just kind of gauging. And just honestly, I didn't sleep well because I'm like, you know what? I was waiting for them to open, the doctor's office to open so I can go in. So I go in the next day. They check. And so by the time I get to the doctor's, actually, I stopped bleeding. Because I guess like he cleaned whatever he cleaned that was there. And it was more like brown discharge at this point. So I went there and I was perfectly fine. Baby was fine. I was fine. That was that. So that was like November. And so I want to be honest with you, that brown discharge did not stop completely. I can't tell you when. Maybe right before Christmas. So it would come and go. This brown discharge would come and go. And it would be like, honestly, nasty to me. Like more brown discharge than that I've experienced when I'm on my period. And so anyway, it stopped before Christmas. Christmas came. I'm like, oh, thank God it's finished. Went into the new year, literally New Year Day. I'm like, oh God, thank you. I'm going to go into the new year, rest of my pregnancy, not experiencing any type of blood. Then it popped up, I want to say the same week of New Year's. And I'm like, what is this? So it happens again. At this point, I'm like, I call my OB. They tell me, again, describe your symptoms. I wasn't like cramping or anything. But they're like, oh, we need you to we encourage you to go to the ER. And I'm like, well, what are they going to do if I come to at this point, the ER is not really the ER. It's really the, what is it called? Labor and delivery. That's where I go because I'm pregnant. So go to labor and delivery. I'm like, what are they going to do? And honestly, to be real with y'all, that's money. So I'm like, I'm not about to be popping into these different appointments. I already go to a doctor outside of my OB every 4 weeks because I have fibroids. So I'm like, I'm okay. I don't want nothing to. So I was like, I felt like I was fine. And I was also watching. I wore my pad and I was kind of detecting and seeing baby was moving. He felt fine. So I'm like, I'll gauge it and see. And so the doctor called me from the ER, labor and delivery, and said, you know what? If, we're here if you need us, but it seems like since this has been happening on and off since last year at this point, just keep an eye on it and know that we're here if you need us. And so that was that. And plus I already had a doctor's appointment, I want to say scheduled later, the following week. So go to the doctor's appointment the following week. I finally see my OB, and she, again, they want to see if I have any type of infection, whatever. No infections. They tested all of that. All of that came back negative. She used a Q-tip. Oh my gosh. Use a Q-tip to kind of scrape the remnant of the brown discharge, and she noticed the brown discharge. Chipotle. Hold on, my husband's asking if I want Chipotle. Hold on one second. Yes, please. Okay. Chipotle, yummy. Oh, so I'm still doing this, not buying food out, but if people buy me food, I'm not going to deny it. So I may have to pause this video in a second because he's going to ask me what I want. So I will be back. All right, I'm back. So I had to order that Chipotle, you know. But anyway, so something's wrong with this thing. Yeah, so that was that. And then, when I went in, she did the swab thing. She knows the same thing. Let me scrape it out so you don't have a lot of, you may experience more bleeding, whatever. So at this point, I'm like, what is this? Because I can't just be bleeding like this. What is this? And she said it could be placental abruption. It could be placental previa. But she said if it is, it's not a severe case of it. She said, my thing is, we don't know. She said she said we can't see the placenta. 60% of the time, we can't really detect if it's the placenta because sometimes it's hiding. The blood could be hiding somewhere that they can't detect on their monitors, which I feel like they need to, you know. But anyway, so I was like, okay. She's like, because you're not bleeding, you would bleed excessively and have other symptoms as well. So I said, okay. So she said, let's just keep an eye on it, and we can go from there. So I said, okay. So that was that. So I walked away with, she said more so a placenta abruption. So let's see what placenta abruption is. Because I mean, honestly, I can't tell you. I'm just going to type with my fingers so I can get to it faster. Placenta abruption is when the placenta separates early from the uterus. In other words, separates before childbirth, God forbid. It occurs mostly around 25 weeks of pregnancy, no longer than 25 weeks. Symptoms may include vaginal bleeding, because I have that, lower abdominal pain, and dangerously low blood pressure. I don't have low blood pressure. So risk factors, smoking, preeclampsia, previous something else. And so let's just look at placenta previa really quick so we can see. Placenta previa attaches inside the uterus, but is abnormal position near or over the cervical opening. Symptoms include vaginal. Bleeding is bright red and tends not to be associated with pain. Bleeding after delivery. Fetal growth restriction. My son is growing perfectly fine. So anyway, I rebuke all of this because I don't have that. So treatment for this would be, for the placenta previa, would be C-section, bed rest. They have not told me that I needed to do any type of bed rest. So anyway, let me tell you what the doctor that I saw this past week told me. So let me just give you the positive news. The positive news is my son is growing. He's fine. As you guys know, I have fibroids. And so with fibroids, good news is the fibroids are shrinking. So I have like 2 or 3 large fibroids, almost like a size of like a lemon, I would say, or even a little bigger when I had my daughter. And so with fibroids, I have intrauterine fibroids. And so it can be dangerous. It can take nutrients away from the baby. That's the bad side of it. It could take nutrients away from the baby, where the baby could possibly pass. So again, that's not my portion. That didn't happen with Zoe. Is not happening with my son at all. And so when we looked at the fibroids, so when I go into these appointments, we look at the fibroids first, and we're able to see that so far the fibroids seems like it has a lot of calcium on it. So meaning that they're degenerating. So that means they're shrinking. So I'm like, praise God. So that's something that I'm always just praying to God that the fibroids are not preventing anything or taking anything away from my babies. And so the fibroids are shrinking. Now I have so many fibroids. Like I have little tiny ones, several. And so my plan was for me to take them out before I had my second baby, but that didn't happen. But they've never caused me any pain. But I will say the fibroids, I'm now associating those fibroids with cramps because I've always had bad, severe cramps growing up, like bad, crawling on the floor, crying, need to soap in the tub every night when I was on my period because my cramps were that bad. So anyway, so fibroids are shrinking, which is great. Baby is 3 pounds, 15 ounces, basically, almost at this point, let's just say he's 4 pounds. And he's 67 percentile. So he's doing really good. He's exactly where he needs to be. And baby has a lot of hair. I wanted to show you guys the sonogram. I put it on the fridge. But I'll show you guys next time maybe. But he has a lot of hair. So, I mean, which isn't surprising because my daughter came out with a lot of hair as well. But she did say, I asked about the placental abruption. She said, I don't think you have that. She said, or placental previa, definitely not placental previa, but she said, otherwise you would experience a lot of vaginal, bleeding and you'll be aching and things like that. She said, you'll be soaking up the pad. She said, that's how severe it can be. So she said, doesn't seem like there's anything wrong with the placenta. She took me back in. She looked over everything. She said that it could be something. She said that the cervical is very vascular. So what does that mean? Let's see. So I did not ask for that. Okay. So when they say your cervix is vascular, they're saying, because your cervix is cone-shaped, lower part of your uterus, it acts as a bridge between your acts as a bridge between your uterus and vagina. The word friable refers to tissue that tears, and bleeds more easily when touched. If your cervix tissue becomes overly sensitive and easily irritated, it's known as a friable cervix. So what she thinks that my cervix is just vascular. It's very sensitive to touch, and anything that could be rubbing could cause it to bleed. And it's like, she said, it's like a wound. So every time you rub it, it just bleeds. And so that's where this excessive brown discharge and bleeding is coming from. So I'm like, I'm not doing anything to cause that. I don't know. So, what am I trying to say here? So she was saying it also could be cervix canal polyps. And she was saying that it'll be interesting to see after I have my child, especially if I have him vaginally, he could just bring out all the blood and that would be it. She said, if not, it could be a polyp that could be in there. So let me look at, I don't really know what that is. Okay, cervical polyp in the cervix. So are small elongated tumors that grow on the cervix. They're most common in women in 40s and 50s who've had more than one child. Well, I'm in my 30s. I just got here. So anyway, so I'm just looking to see. I no longer stressing about this stuff, guys. So long as the baby's fine, I'm fine. Blood sugars, I'm maintaining those just to make sure he's not growing rapidly too fast, and me too. So everything seems to be great. And so I've been bleeding on and off. And so right now, bleeding started, I want to say yesterday. So now I'm just kind of monitoring it. Again, I wear my pad just to kind of monitor the bleeding. But that's pretty much it for now. But yeah, so I don't know if any of you other moms, or if you know of anyone who have had something similar to this or experienced something like this, but that's just been my experience with this pregnancy. Obviously, yes, it can be a little scary and frightening, but I've literally given it all to God. And I have no doubt that I will deliver a healthy baby boy, and I will be healthy post baby. So that's it for now. My Chipotle just walked through the door. So I will catch you guys next time. Make sure you subscribe, like, comment, share. And that's it. Peace and love.